Hey everybody, good afternoon to you. It's Dr. Q Jordan with Fearless Physical Therapy. Today we're going to go over a couple taping techniques because I've had some patients tell me that they've gone on walks and everything for the first time and they're starting to get some ankle pain and they just want to kind of alleviate the pain a little bit while they continue with the walking. And since they weren't able to come in this week, I couldn't give them any new exercises. So I'm a few taping techniques to help to reduce that pain. And then also going to show you a taping technique for your back to help to reduce that pain. With the one for the back, definitely you're going to need somebody else to help you. With the one with the ankle, if you're pretty mobile, you'll be able to do it yourself. All right, so I got pre-cut tape here because with the taping techniques, you need to have the edges rounded, and if anybody knows me, knows my arts and craft skills are sorely lacking. So, yeah, makes it easier. One thing to note that try not to put on lotion before you tape. If you do, it's gonna make it slippery and it's not gonna be as adhesive, and so it's gonna come off a little bit more easy. So we got we're gonna take 4 strips because I'm gonna do 2 different techniques with her. All right. So the first one, I'm gonna start here. The medial malleolus, part of the ankle bone. I'm gonna tear off the edge. I'm gonna come down with just a little bit of a stretch. Then once I get to the bottom of the foot, there's going to be no stretch. And then I'm going to come up top. I like to curve it around a little bit. You can have it going straight up the other side of the leg. Using personal preference. To me, when I put it on, it just feels better like that. And I'm going to rub it down to make sure it sticks. And with her, she used a lot of lotion, so it's not going to stick. But, so here's the tape. Bend your knee for me. Then, the other piece, I'm going to split down the middle. I'm going to lift her leg up. And I'm basically going right at the heel. Just a little bit above. And I'm coming forward with one side. And then I'm coming forward with the other. So, bend your knee for me again. So that's one taping technique. The one I normally use, especially for myself. So we're going to take this off. Normally wouldn't pull it off quite so fast because it'll pull some hair, but since she's all lotioned up, it's coming off easy. All right. She's going to get me too about the, putting stuff on the floor. So we're going to start off at the same spot. The medial malleolus. We're going to put it right here. And we're going to come around the front and at an angle down. And we're going to go, no stretch here. We're going to rub it down. And so that's what it looks like. And for the other side, we're going to basically go the other way. So just below the lateral malleolus. And that piece came off. So we'll try that again. Now, you can get the tape from most of the big box stores and most of the pharmacies. You can also go on my website, www.fearlessphysicaltherapist.com, and there's a link to get tape from a vendor. And we'll come across. And so we'll want to try to not have too much overlap on the tape. We would prefer none, but sometimes it just happens. So here. And as you can see, it's rolling up because of the lotion. And here. Cool. And with the tape, you can usually find a bunch of different colors, different designs. The kids like to use one that has tribal ink. So they think it makes them look like The Rock. So that's the ankle. And you also have some that are latex free. Most of them are waterproof. And so you just find the one that you like. All right, can I get you to stand up for me, please? So the next one is going to be for her back. So she's going to face this way. We're going to lift up her shirt. Okay, and we're going to lower her pants down a little bit. And so there are two different ways to do the low back. Both of them start the same way to initiate. So we're going to have a bend forward, right about there. And so we're going to say that her back pain is about here and here. You can go from end to end or you can start in the middle. I'm going to show you both right now. So just to the side of the back. Here. Apply a little bit of a stretch. And then to the other side. And I maybe applied a little bit too much stretch right there. You no more than about 50%. And you can tell by the percent. It's because most of them have designs. And the more you pull on it, the more the design becomes visible. And so you can look on the box for that. And so the next one we'll put just a little bit lower, making sure they don't overlap. And see, I can't even tape in a straight line. But you want to make sure they don't overlap. There's a little bit of space. And go ahead and stand up. And as she stands up, you see there's some wrinkles. The wrinkles let you know you did a good job. It's in a pretty good spot. You want there to be wrinkles. All right, bend back over for me, please. So we're going to show you another taping technique for the back. This is the one we were showing in school. She's going to, like I said, she's going to bend over. We're going to start at the PSIS. There's a little bone on both sides. If you feel in the back and you kind of march in place, you can feel a little bone right there. We're going to go just a little bit above it. And it tickles. She's very ticklish. Have a bend, lean forward. You're good. And we're going to go up. And you don't want to go too high. So normally I would cut it about here for her. But I'm going to go up just to show. Then I'm going to come over to the other side. And then the same thing. And then once again, rub it down. And you want it to try to be as a straight line on both sides. Once again, I failed hard. I'm sorry. That's why I normally show my patients how to do it, so I don't have to do it anymore. All right, go ahead and stand up. And we got a little bit of wrinklage. Come back down. Back up. And then twist and turn for me. Good. All right. So those are a couple taping techniques for your ankle pain and for your back pain. If there's any questions, shoot me an email. You can get me at Facebook at fearlesspt06 or on Instagram also at fearlesspt06. Thank you. Have a blessed day.